A 23 years old lady present with itchy, bleeding pigmented lesion on her right thigh. What is the best course of the action? Here are the options. Options is core biopsy, pans biopsy, incisional biopsy, excisional biopsy, and wide excision. So again, a 23 years old lady present with an itchy bleeding pigmented lesion on her right thigh. So there is a lesion which is pigmented and itchy present in the thigh. So we have to take decision according to the biopsy. That means what type of biopsy we should take. So first of all, let's see the malignant melanoma. This is represent malignant melanoma. That means as it is the EC bleeding occur and pigmented lesion in her thigh, so it may be malignant melanoma, but it may be benign lesion, or it may be another cancer such as squamous cell carcinoma, basal cell carcinoma, or it may be just benign, very benign condition. So the lesion, as there is no details condition, so it may be benign but may be malignant. But as it is very EC, may be malignant, but some benign case also EC, there is bleeding, some benign condition may causes EC, but we have to suspicion for both the benign and malignant condition. So what we have to do, we can do the complete excision and proper histopathological assessment. So first of all, what we can do the complete excision of the lesion and we send for histopathological examination. If the diagnosis is confirmed, then re-excision of the margin may be required. So sometime when there is excision with a small margin, but there suddenly it is confirmed by the histopathological examination that it is the malignant case. So in this condition, re-excision may require sometimes. Clearly, if the lesion is benign, there is no further action. But when there is benign, no action is required. Here we can see this is the these are the malignant melanoma, and here we can see there is a excision done of the malignant melanoma. When histopathological examination proved that this is the malignant condition, so in this condition they required re-excision. And some clinical diagnosis which leads it may be malignant. First of all, change in size very fast, irregular pigment, irregular outline, diameter more than 6 mm, inflammation, oozing, bleeding, itchy, altered sensation. In this case, there is oozing or bleeding present and also the itching present. So we suspect that this may be a malignant case, but it is not final all time. So what we can do complete excisional biopsy. That means the whole of the tissue we should remove and send for histopathological examination. And this line is very, very important, that when we suspect melanoma, not only melanoma, when we suspect any type of the carcinoma, in this condition we should avoid the incisional or pans biopsy, because why we should avoid incisional or pans biopsy? Because in case of incisional biopsy or pans biopsy, there is chance of a spread of the malignant tissue in the surroundings area. So when we think it may be malignancy, in this condition we should go for the excisional biopsy.